Starting. Okay, I think it's on live.
Oh, very
Should I Skype now?
Yes, Skype can be on. We don't need Skype. So
Yeah, this is a call. This is a separate line and call.
Yeah, so you can continue.
A very good evening to all of you who are attending the call. On behalf of the Social Committee of MCA-EC, I welcome you to the second session of Empower series this fall. Today's Empower series session is about health, and we have Dr. Halowine, who would be speaking about migraines. A little about Halowine. She is one of the 6 children of late Joseph Raskina and late Dulcet Matthias of Upper Bendar, Mangalore. Her father was a sound engineer and an entrepreneur in Raipur. Her mother was a homemaker who inculcated leadership qualities in all her children. Halowine did her early primary schooling in Raipur and her high school and college education at St. Agnes, Mangalore. Throughout her career, she has excelled in her studies as well as displayed her talents in elocution, art, and music. Halowine joined the first batch of students at Father Muller's Homeopathic Medical College and was voted every year as the Outstanding Student of the Year. She not only excelled in academics, but also in leadership qualities and extracurricular activities. After her education, she joined the faculty of Father Muller's Homeopathic Medical College, Mangalore, and was selected to attend the individual development course conducted by the HRD cell at Mangalore University. Dr. Halowine was awarded a gold medal for her MD in homeopathic and her thesis of Kent's repertory for the treatment of migraine. She was also one of the first to receive a license to practice homeopathy in the United Arab Emirates, and she has completed around 15 years of private practice in Dubai. She also has her homeopathic consultancy in Cupertino under the California Board of Homeopathy, America. She is married to Mr. Noel Coelho, who is an entrepreneur, and they are settled in Dubai. They have 2 sons, namely Nigel and Carl, who are currently studying in the US universities. And to also add to the list of achievements, we have a testimony from Maithili. Maithili told that she suffered from allergic rashes and migraines and had taken a couple of medication and painkillers. But that didn't help her. She then consulted Dr. Halowine, who prescribed her some homeopathic medicine. She's been taking that since then and has never had any occurrences of any allergic reaction or any migraines. And she's extremely happy and satisfied with the result and is thankful to Dr. Halowine. So over to you, Dr. Halowine. You can give us a whole explanation about migraines and allow everyone to get a very clear idea about what are the main causes of migraines and how can one overcome it.
Okay, thank you. Thanks a lot, Norma. I'm so glad to be here with you. I hope you can hear me.
Oh, yes, we can. Yep.
Yes, okay. I would like to start with the introduction to migraine, the cause and management, and the homeopathic treatment about it. Because many people say migraine is incurable, but in my practice, I found that I was able to help a lot of patients, and not only were they relieved, but they were cured because the paroxysms of attacks did not come back anymore. In other words, migraine has been cured, so the patients say themselves. I would like to walk you through what are the main trigger factors, as well as how it can be managed well with generally and with homeopathy. To begin with, am I clear, Norma? Just checking.
Yes, we are.
Okay, thank you. So migraine is defined as a triad of paroxysmal headache, nausea, with or without vomiting. If it is accompanied with an aura, migraine, and a migraine without aura is called common migraine. The cause is not really known. Am I too loud?
Oh, no, you're clear. Everyone can hear you.
Yeah? Okay. Okay. The cause is not really known, but it's found that there is a genetic predisposition. So if there's a family history of migraine, then the other members also will have a tendency to get it. And more often, it's the female preponderance, meaning to say the women in the family may get it, not necessarily the men. This is where you can differentiate from cluster headaches. Cluster headaches tend to be more in men as compared to migraine being more common in women. Maybe it's because of the hormonal effects that are there. Because normally it tends to come before menses when there is a progesterone kicks in, just as you get the PMS, the premenstrual symptoms. So migraine is one of the premenstrual symptoms during that time. And another reason could be food intolerances and allergies, because many people who have tend to say that they get their headaches, migraine headaches after eating cheese or chocolates or some red wine or colored foods, which can trigger this to come on. Also, occasionally, psychological stress and strain does play a big role in it, because demanding conditions where you're burning a candle at both ends can cause a big stress on the person, and then the body tends to break down as migraine. So these are some of the causes, and very often, hello?
Yep. Yes, we can hear you.
Yes, Norma, am I clear?
Yep. Yes, you are.
Okay. Also, bright lights, glare, eye strain, watching the binge watching. These are some lack of sleep, or maybe if you miss a meal. These are some of the reasons that migraines come on. So based all these factors which are positive are also important in homeopathy, because based on that we can select the remedy, because we need to take a detailed case history about the patient to know what is the situation that brings it on, what makes it worse, what makes it better, and also to know a little about the personality of the person, because the personality is what will determine how you react to the environment. Because not everyone has the same, given the same background, given the same environment, given the same office stress or the family stress, not everyone has. You understand?
Mm-hmm.
Yes. Anything, please feel free to stop me if you want to clarify anything, right?
Oh, yeah, sure. Mm-hmm.
Yes.
Should we go to the next slide?
Norma?
Yep. Should we go to the next slide?
Yes. Go to the next slide now.
Okay.
Yeah. So now I would like to talk about the lifestyle factor, because I've done a study here in Dubai where I practice, and I find in Dubai most of the population are expats from all over the world.
Mm-hmm.
Security of life away from a supportive family network, pressure of job, deadlines, family and social pressure trigger migraine in susceptible individuals.
Mm-hmm.
And then also we live in a desert environment. So most of the people tend to be indoors with the AC on, and outdoors there's a harsh glare, extreme heat, and also when you go from the heat you come into the chill, the change in temperature does affect the person too.
Mm-hmm.
And of course, as you have anywhere in the world, we have a long commute, an early start to the workplace. Then there's the traffic to deal with, then erratic eating habits due to rushing to and fro to work, and not enough rest.
Mm-hmm.
So these may precipitate the migraine attacks.
Mm-hmm.
Yeah, and it is seen more often in women. You know why? Because they have to cope both with the office pressure as well as the pressure at home, having to deal with the family, take care of the kids, their studies, the cooking. So it's literally burning their candle at both ends, which a price has to be paid. And more often than not, our body has its own intelligence. So it cries out to slow down. Maybe sometimes this migraine headache may be a sign, a cry from the body to say slow down and makes you take rest. You understand?
Yep.
Yeah. So basically what we in homeopathy, the understanding is we have to tap into the body's symptoms. The symptoms are the cry of the body. It is asking for what it requires. That's the reason we take the symptomatology so much in detail. The reason being these symptoms tell us what is required. And when we have a remedy, a homeopathic remedy which matches these symptomatology, it's called the totality of symptoms. Yeah. So the totality of the patient, when it matches the totality of the remedy, and when we give this remedy, that's when you have the resonance, and it tends to cure the patient. Yeah. And the high cost of living in this part of the world, which I'm sure also is in the US or anywhere in the world, the cost of living makes many things unaffordable. So we tend to overload ourselves, try to do everything ourselves. So there is a physical strain and a nervous breakdown too. Very often migraine is the pattern of migraine shows that at certain time of the month or certain time of the whenever there are deadlines, that's when you tend to get. Or sometimes it's also where you're working very hard to reach the deadline. When once it's done and dusted, then you break down with migraine. So weekend migraine is very common. That is another pattern that sets up because you're working helter-skelter whole week, and then towards the end of the week, you just lie down and your head is throbbing. Instead of just relaxing, you're having a terrible, terrible headache with nausea, vomiting, and only after you vomit, you feel better, and you just want to be in a dark room, tie a band around your head and relax. You don't want to eat, you don't want to interact, and your weekend is also gone.
True.
Yeah. So based on what is the presentation, we tend to give different homeopathic remedies. You can use the next slide, Norma.
Okay. Yep.
Yeah, I will explain. Yeah, I will go through the migraine triggers. Isn't that the slide what shows?
Oh, yes, it is.
Yeah, okay.
Yes.
So as I alluded before to food sensitivity, so the foods that can cause the common offenders are alcohol, particularly beer and red wine. Not so much white wine. The reason is not known, probably because of resveratrol, which is supposedly good, but in certain individuals who have food intolerances, it can cause a reaction. Another cause is dairy products. So cheese and other forms of dairy products can also trigger it. Some people, maybe eggs, citrus, tomatoes, nuts, red meat, and very often shellfish. Surprisingly, many people are very, very allergic or intolerant of shellfish like shrimp, crab, and mussels. So they do report that these are this is what I had, and then this headache came on. And anytime I do have this, it tends to recur again with not only the throbbing headache, but also the nausea sensation. And only when that offending article is out of their gastrointestinal system, only then they are free of it settles down and they're feeling back to normal. Also, some people do have gluten sensitivity. As you know, many even celebrities have been talking about gluten-free diet, and now see that seems to be the trend. So whether it's real or imaginary, we don't know. But when we see patients reporting, yes, after having certain wheat products, they have had this headache, and every time they touch it, it comes back again, means there is a definite cause and effect factor.
Mm-hmm.
Also, some pickled and marinated foods, also fermented foods, do have probably something to do with the chemical composition of them that alters the vegetable or meat which has been pickled. So very often times I find that people say after a certain pickled product, they have had these migraine attacks. And they've never had any reaction before, but most allergies and intolerances tend to be like a bucket filling up. So you don't see the water splashing when the bucket is filling up. You're just taking it in. The whole bucket is filling up, but you don't see the effect. But once it's full, even the slightest drop tends to splash. So similarly, symptoms of food intolerances, allergies also don't have any reaction for years together. But once the bucket is full and there's no more, the body can't take it anymore, then even the slightest exposure will have the symptom coming on.
Mm-hmm.
Any clarification?
I don't think so. Nope. Nope, it's clear.
Yeah, no. And also a certain Chinese food, because of the additives like monosodium glutamate, can trigger it. So many people say after a weekend of having Chinese food, they tend to get a migraine. And something about the curiosity about caffeine is if you have a headache, it tends to go away, but too much of caffeine can also cause a headache.
Mm-hmm.
And most of the over-the-counter medication for migraine contains caffeine. So if you take coffee and that painkiller, it becomes an overdose of caffeine.
Oh, okay.
You understand?
Mm-hmm.
Yeah. So that can make instead of relieving the headache, it can make it get worse.
Yep.
So that's the paradox, the caffeine paradox.
Mm-hmm.
Yeah. Then, as I told you, certain people who skip meals because of the work deadline,
Mm-hmm.
this can also cause, because the body goes into hypoglycemia, especially the brain is very sensitive to sugar levels in the blood. So if you skip meals, it can bring on a headache because the brain cells don't have enough to work on, enough sugar to work, and so they react, and there are released, the serotonin in the brain drops, and the neuropeptides are released, and that is what causes intracerebral vasoconstriction, meaning to say within the brain, the blood vessels constrict or tighten. And outside in the scalp, the blood vessels dilate in reaction to these neuropeptides which are released. And due to that, this typical throbbing sensation in the head is what is migraine, along with the feeling of nausea, vomiting, and weakness, exhaustion. Some patients who have classical migraine, it may start prodrome, meaning to say the symptoms before the headache come on, may present as visual, where you feel like some electrical, like electricity or current or zigzag feeling. You feel or circles like a movie saying reel turning round and round, wheels turning round in the peripheral vision. These are some of the symptoms that you can experience as an aura. That is before the symptoms come on. Yeah. And also, if you lose sleep, that is another reason that you can get, like people who work late into the night due to deadline or binge watching over the weekend, they wake up with a severe migraine headache and vomiting.
Yes. Mm-hmm.
Yeah. Am I clear?
Oh, yes, you are.
Yeah, okay. Just let me know if I'm going too fast or should I slow down. Is the pace okay?
Oh, yes, the pace is fine. I mean, it's already being recorded, so everybody can hear it and they can ask questions automatically.
Okay. Okay, fine. So I'll go through the whole talk and then I'll take the questions in the end.
Mm-hmm. Oh, yes. Mm-hmm. Yes.
Okay, fine. So then I was telling about the sensory ailments that are there, bright lights and sun glare. So in this part of the world, the sun glare has a tremendous effect on producing this headache. So and also unusual smells like perfumes, flowers, or also odors of paint like a freshly painted home, or even filling gas at the petrol station. That can also have triggered a headache because of the fume. You inhale the fume. It can, or even secondhand smoke, like if you're at a club and everyone's smoking and you inhale it, it can trigger a migraine attack. A migraine attack in females after going to a disco is one of the most common reported symptoms that I've found because of the smoke, the lights, the strobe lights, and that because the sensory thing goes into your eye, and from the eye, the trigeminal nerve takes it to your brain stem, and then there's a reaction from the brain stem, and the whole brain tends to react to it. And it is also found that calcium channel ions are one of the pathways, pain pathways. So that is another way. Once we know the cause, to deal with it, we can also go along the same lines, because the cure is in, once you have defined a problem, the resolution presents itself.
Yeah. Mm-hmm.
Yeah. So a patient, we ask the patient to keep a diary so that they know what are the trigger factors, what happened just before this attack, and then we see a pattern. Once you see a pattern of trigger factors, we are able to help them to redefine their lifestyle so that they are able to make the changes in their life which are required, not to provoke the migraine attacks.
Okay.
Yeah. And sometimes when you go to for a holiday at an altitude, or the weather is different, or it's very hot and humid compared to what lifestyle you have, and time zone, when you're jet lagged, these are all the reasons that migraine can be triggered during this. Although it is supposed to be a change of environment and you are looking forward to the holiday, but the very change itself can trigger it, because you're used to a routine of being safe and time to time everything. When the routine has changed, it can also cause a migraine headache.
Mm-hmm.
Yeah, and very often we have heard the term where the lady said, "Not tonight, darling," and it's with good reason because it is found that intense physical exertion, including sexual activity, may provoke migraine changes in sleep pattern, including too much or too little sleep to initiate a migraine headache.
Mm-hmm.
Yeah. The next slide, Norma, about toxins.
Okay. Yeah.
Yeah. So, very often we find that constipation due to the toxins it produces can also cause a headache. So these are called gastric headaches, where due to the gastrointestinal system not being healthy, causes the brain to react because the toxins are in the blood. And also many people have bilious headache, where the bile tends to cause the headaches to come on. So the headache is only relieved when you have a bilious vomiting. Yeah.
Mm-hmm.
And hello.
Yep.
Yeah.
Yes. Mm-hmm.
Did you get me about
Yes.
the liver having a role to play also? And as I mentioned before about women premenstrual, there is water retention in many women just before due to the progesterone effect. So these are what causes the premenstrual symptoms.
Mm-hmm.
So due to the PMS, the migraine headache accompanies with general engorgement. So women not only complain of migraine headache but also breast tenderness, backaches, leg pain, and bloating, abdominal bloating too, gas. So these are all symptoms that accompany the premenstrual symptoms along with mood swings. And these are all related to the hormonal changes, particularly progesterone, which kicks in. And this is reconfirmed because during pregnancy and after menopause, most women who have suffered from migraine no longer have those headaches. So obviously that hints towards the hormonal effect that plays a big role in the trigger or the cause of migraine. So depending on what is the cause, the founder of homeopathy, that is Dr. Samuel Hahnemann, has said the highest mission of a physician is to restore the sick to health, to cure. And this cure, the ideal cure, is rapid, gentle, and permanent restoration of health. So based on these things that I have learned about the philosophy and the treatment of how homeopathy treats, I have formed a website which is called idealhomeopathy.com. So any of the persons interested to know more about homeopathy can go on my website, which is www.idealhomeopathy.com, which tells about what is an ideal cure and what are the treatments available. And particularly for migraine, I have had a very good success rate. In fact, I got my gold medal for my thesis on migraine for my MD. So I'm happy to share with you all these details that I have not only seen in my practice, but also been able to heal people with these conditions.
Mm-hmm. Do you want me to go to the next slide?
Would you put the slide about clinical features, the symptoms?
Symptoms of migraine?
Yeah, symptoms of migraine.
Okay. Yeah, I've done it.
You got it? Okay.
Yes.
So a typical migraine headache attack produces some or all of these signs and symptoms. First, moderate to severe pain. Many migraine headache sufferers feel pain only on one side or both sides. And the pain is of throbbing quality, as if like you can feel the pulsation of the blood vessels. They will definitely worsen with physical activity. Any movement, even turning in bed can cause a headache to increase because of the pounding pain. And also it hinders from daily activities. There's nausea with or without vomiting. And many people who say, if only I can vomit, my headache will be better. So much so they even trigger vomiting so that to get the stomach, the contents of the stomach out so that they can feel a relief in their headache. And this is a very common symptom seen in most patients who induce vomiting to relieve their headache.
Mm-hmm.
Yeah. And the aura that I was telling you about classical headache, they tend to be flashes of light, dazzling zigzag lines in the field of vision, slowly spreading blind spots. So it's very dangerous to drive when you have an aura coming on. So it's best to pull over or ask someone else to take the wheel, because sooner or later, within seconds, minutes, or an hour, the headache is going to come. So these are signs the body is speaking to you to slow down or to make some arrangement so that you are able to avoid any disaster. Right? Yeah. So also some people have certain strange sensations like a feeling of elation or intense energy just before the headache, and some also have a prodrome with craving for sweet. And these symptoms are very important in homeopathy because they are rare, queer, peculiar symptoms which will lead us to the right remedy. And as say a patient saying that doctor, I have craving for sweet just before the headache comes on, immediately I think of certain remedies which have this particular sensation of craving for sweet, or excess thirst, where they are thirsty and just feel like downing more and more water, which I'm feeling now while I'm talking to you. So I'll take a sip. Yeah. Okay, so these are various symptoms that patients present: drowsiness, irritability, depression. These are all striking symptoms which are a premonition that a headache is going to come on. Okay. So next I would like to talk about how to prevent and what are the self-care techniques and coping skills that we can adopt in order to manage. This is the management part of migraine. So Norma, I would request you to put the next slide about prevention.
Okay, sure. Yes, I've done that.
Yeah, you got it? Right?
Yes.
So lifestyle changes can help reduce the number and severity of migraine. 1. Avoid triggers. If certain foods trigger migraine attacks, they are to be avoided. If certain scents are a problem, try to avoid them. In general, try to establish a daily routine with regular sleep patterns and regular meals. Secondly, exercise regularly. Regular aerobic exercise reduces tension and can help prevent migraine. Warm up slowly. However, because sudden intense exercise can cause headaches, walking, swimming, cycling, and other enjoyable exercises are recommended. Reduce the effects of estrogen in women, where estrogen seems to be the trigger or makes the migraine headache worse. Have a family history of stroke or high blood pressure. Reduce the amount of medication containing estrogen, including oral contraceptive pills and hormone replacement therapy. And people who are smokers, if they reduce their smoking, or if they find that headache is triggered by smoking, then they have to try to give it up or not expose themselves to second-hand smoke to stop the migraine triggers. Right? And self-care, as I spoke before about keeping a diary, because then you are able to walk through and see a pattern. Once a pattern is seen, you can change it or you can delete the aggravating factors. There is also something called muscle relaxation exercises. Progressive muscle relaxation, meditation, yoga can help to loosen tight muscles and improve the blood flow. Many yogis say the headstand helps for the blood flow to the brain, and that can also help to relieve the migraine headaches. And deep breathing, pranayama. So every day doing this pattern of breathing so that the oxygenation is adequate for the brain will help in case of migraine. So pranayama not only helps you to calm your emotional state and also to have a relaxed physical state, it also helps in lung expansion and get rid of the old air in the lung and fill it with fresh oxygenated and to get the blood oxygenated by doing a proper breathing technique. So many people can look online and see how to do these breathing exercises YAMA. It's a yogic breathing exercise. And I found remarkable changes in people who have adopted this lifestyle because it helps them not only to manage their emotional state, their physical condition, as well as to be more in tune with nature.
Mm-hmm.
And also to take up some relaxing exercises like gardening, reading, listening to music, or relaxing in a shower rather than, pushing themselves too much by sleeping late, going out to discos late night, because a lifestyle change will make a big difference in the management of their condition.
Mm-hmm.
And I can't stress enough about sleep. The average adult needs 7 hours of sleep a night. Too little or too much can both lead to migraine headaches. So if you sleep too little, or also because it's a weekend, you oversleep, both can cause a problem and you can wake up with a throbbing headache. So late night, eat late, alcohol, a combination which is really lethal and can precipitate migraine attacks.
Mm-hmm.
Yeah. So I think I'm asking for too much of austerity, but we all have to listen to our body. Some people can do everything with no problem, but some others can't. So each of us has a weakest link. Like if some have cold drinks or iced or ice cream, they tend to get a throat involvement. So we say about similar to Ayurveda, where you say about the type of your body type. You should know whether it's Kapha, Pitta, and Vata, Pitta, Kapha. So similarly, in homeopathy also we have different types, different constitutional body types. It's called miasm. So these miasmatic effects are both inherited from your generations past, as well as due to the environment, your lifestyle, that can also precipitate certain effects. So in combination, we have to be aware about what is our body type, and live our lives accordingly.
Mm-hmm.
Finally, about coping skills. Living with migraine is a daily challenge, and headaches can be both incapacitating and unpredictable, and may interfere with the normal functioning in work, family, and society. The overall quality of life can get affected. Anxiety about a migraine attack coming on may itself precipitate it at inconvenient times. This may lead to further anxiety and depression. The following options may help to cope. Counseling is one way to go about it. Then to balance your body, to balance your lifestyle by having, like I mentioned before, about regular exercise, relaxation techniques, nutritious meals, and adequate rest. And also finally, having support groups. Once you know there are others also who have a similar problem, you interact, and then it helps you to make better changes in your life with the help of others. So these are some of the ways that we can manage migraine and also prevent it completely. The homeopathic remedies that come up, as I mentioned about constitutional, the body type, different types of personality types, we take into consideration both the mental aspect and the physical reactions of the person, and we are able to determine a certain type of personality which matches a deep acting remedy. So like I mentioned, there's a final slide, Norma, if you can, the last but one.
Mm-hmm. Yep.
Homeopathy.
Yep, just a second. It's just coming up.
Yeah, take your time.
Mm-hmm. Oh, yes, it's done.
Yeah. So the homeopathic remedies that come up are Silesia, Natramure, and Ignatia. I'll just walk you through a little about the Ignatia personality. She is a very nervous type. So she will be always anxious about things, because she's a perfectionist by nature. So depending on the type of person, we choose a remedy. So a natrimure is also an emotional and very romantic type of person who wants to be treated with kid gloves, but they will not express. They have expectations, but they will not express. So they tend to close the door and cry inside, so that they don't want to show their feelings, but they feel very deeply. I can see that some of your audience has posted some questions.
Mm-hmm.
So I would like to deal with one. I'll go to it later. First, let me walk you through the homeopathic medicines which are there. There are also many acute medicines. So to deal with the headache there and then, with just 1 or 2 doses, the headache will clear up and it doesn't build up. There are remedies like belladonna, bryonia, gelsemium, iris versicolor, and nux vomica. So all these medicines I have put on the homeopathic treatment. I've described what is the type of headache they tend to have, and what makes it worse, what makes it better, the type of sensation, and whether there's aura. So when we take all that into consideration, we are able to choose the right remedy, and it relieves the headache. And when we give a deep acting remedy, constitutional remedy, it will rid the person of headache for life. And that is what is cure. To restore the former life of the person. So this is in a nutshell what I can tell you about homeopathic treatment and general management of migraine, having walked through the cause and the trigger factors.
Yep.
Thank you, Norma and Mark, for giving me an opportunity to give this talk. And now I will answer whatever questions you would like to present to me.
Oh yeah, sure, Dr. Halowine. Thank you so much for the wonderful talk and for briefly explaining about migraines, the causes and the triggers. So now for the questions, I think the most common question that everybody has is, what is the difference between headache versus migraine? So please could you emphasize on that?
So the difference between migraine is always accompanied with the gastrointestinal system. So there is nausea and vomiting. Whereas a tension headache, a cluster headache is different. Cluster headache also mimics migraine, but it's not so much seen in women. Migraine is mostly seen in women, whereas cluster headache is seen in men. And cluster headaches tend to come with one, if it is one-sided, the eye also gets involved. There's inflammation in the eye and watering in the eye. So it's called pink eye with headache. So cluster headaches tend to be in men, one-sided, accompanied with pink eye. But most people who say headache generally are talking of tension headache. Tension headache is more of muscle spasm in the scalp. So there are muscles which surround so when you're tense due to whatever reason, emotional, physical, or exhaustion, the scalp muscles become taut and tight. So you feel as if there is a cast or as if there's a band around your head. But there's no accompaniment of nausea, vomiting, there's no aura, no visual problem. So just a simple massage around the neck or around the head can help with these general headaches. It's called and these general headaches can be episodic. They come once in a way, or they can become chronic. So that is the difference between migraine, always accompanied with nausea or vomiting, and it is always aggravated by physical exertion, walking, running. You can't do it. Stop you from doing your usual work.
Yep. Thank you, Dr. Halowine, for explaining us the brief difference between both of them. The next question, what we have is, a couple of people had this common question saying that whenever you see a bright light, it causes a headache, or whenever you have a headache and then you see a bright light, your head hurts terribly, and then it's also a sign that you're going to get fever. So does this, would this be called as a migraine, or would this be called as a normal fever symptom?
Yeah, migraine never comes with fever.
Mm-hmm.
It is just a reaction of the brain and the blood vessels to the input, whatever be the environment that has caused, the trigger that has caused, but a fever never accompanies migraine. So that's what differentiates. If you have fever along with the headache, probably you are coming down with a flu or some other infection.
Mm-hmm.
So fever is a sign of infection.
Mm-hmm. Yep, I think that answers the thing. We also had another question that a couple of people have a travel headache or motion sickness, and they keep looking, and they feel very nauseated when they are in a very confined place. So, and that headache keeps on, it continues for the entire travel. So how is this related, and what are the side effects? Because that headache doesn't go off immediately, and it goes on for a while. So just want to know, what is the difference?
Correct. So the thing is, each person reacts to travel differently. So if they know that this is the pattern, that when they travel, they will get this type of headache, they have to take precautions beforehand, as in hydrating themselves well, because dehydration during travel is one of the main reasons that headaches come on.
Mm-hmm. And
so, one is they should see that they have a good night's rest, or set aside time to rest before they travel. So it's better to pack, say, 1 or 2 days beforehand instead of waiting for the last date. And secondly, another thing they can do is keep hydrating themselves, eat well-balanced meals, not anything oily, spicy, or anything that can make them feel uncomfortable, not to have alcohol on the flight in spite of it may be free to, still it's not advisable. Water.
Thank you so much. Actually, during your whole presentation, you also told that when a person has migraine, he gets excessive thirst. But everyone knows that whenever you are feeling extremely thirsty, or when you have excess thirst, it's also one of the symptoms of diabetes. So are they related by any chance, or are they two separate entities?
They are two. There are people who have migraine and don't have diabetes.
Mm-hmm.
You were talking about diabetes, right?
Yes. Mm-hmm.
Yeah. So diabetes is not related to migraine, but yes, each person has a metabolic reaction to different environments. So maybe some diabetics can get migraine, or people who have migraine can go into diabetes later on, but they innately they are not related. No.
Okay. Everybody knows that whenever a person is going through, a person has depression or has suffered a lot, that also causes several episodes of migraine. So, you also told us that all the counseling and support group also helps, but what are the long-term benefits of it? Like, you just have to take any medication for that? Any medication is prescribed, or is it a long-term thing, or is it a short-term solution for that whenever someone has depression?
Basically, what migraine, by the time the patient does come to to me as a homeopathic doctor, they've tried everything in the book, and then they finally come. So what I try to find out is the personality of this person. So a constitutional remedy takes into consideration both the mental aspect, the environment of the person, the reactions to it, so much so I even ask, do you prefer to be in a cooler environment, or you want the AC off? Because each of these symptoms determine who you are. So I need to pick what sort of person. A Sita person is chilly, they feel chill easily, and also they tend to have a lot of miscommunication with the family. So they feel very isolated because they're having fights all around, whether it is at the office and at work, or with neighbors, with the family members, so they feel misunderstood. And that is the reason they suffer. So we need to know, due to depression, due to anxiety, and due to nervousness, the mental makeup of the person and the environment, all these determine how they suffer. And each person suffers in different ways depending on who we are. So once we determine the person, the mental makeup and the physical makeup of the person, we are able to give the right remedy, which may, more often than not, you need to do a 6-month course to be rid of the symptom completely. And after that, for life, it doesn't come back.
Mm-hmm. And Dr. Halowine, you also told that, in general, like if you're providing any medication or if you're prescribing any medication to somebody, how long should someone take the medication? Is it a fixed duration, like a couple of months, or does it go on for a long term?
Yeah, it depends how long the person has suffered from the symptom.
Mm-hmm.
If they've had it like for 5 or 10 years, you may need to do at least 6 months to a year of treatment.
Mm-hmm.
And suppose it's just a recent thing, it's come just say last month or 6 months ago, within 10-15 days they are rid of it.
Mm-hmm. Okay. In India, everywhere it's a very common headache called bile headache, as you told that a person tries to induce induce vomiting. So is it because of unhealthy eating, or is it because of the lack of sleep and the amount of stress? Like, what is the main cause of that?
Yeah, liver is it tends to the job of the liver is to produce bile. Now, in case the bile is used for digesting foods always, in case you don't put the right quality of food or the right time of putting in the food, if there's a delay or there's a change in your life or you're stressed out, these are different reasons that bilious headache comes on. And the bile comes up into your mouth, and till you vomit it out, you have this headache. So these are called gastric headache.
Mm-hmm, mm-hmm.
So yes, we have very good remedies for bilious headache in homeopathy. In fact, I've delineated some of the case studies on my website. So those who are interested to know about it, what are the conditions that homeopathy helps with, and how the patients have responded, I have some case studies and testimonials on my site, which is called www.idealhomeopathy.com, and different case studies come up. So your audience, if they are interested, can go on that site and read about it, and they'll know about what conditions homeopathy helps with besides migraine.
Yep, I think that's pretty much of the questions that we had. So thank you, Dr. Halowine, for waking up at 4 a.m. away time and giving us your time and letting us sleep.
I've done night duties before.
Yeah, thank you so much for giving us a brief idea on migraines and answering a couple of our viewers' questions. And I'm sure that we will take the necessary steps in order to avoid migraine, or we will follow the instructions. And if not, we can always go to your website, which is www.idealhomeopathy.com. And we can also find the causes, and we can also have a diary which lists what our day-to-day activities which could trigger it. And if not, we could just come up to you, or people could reach out to you, and we could just see how to take it from there.
And anyone who has migraine among your audience, or they want to refer me, my telephone is there on my website. They can call me anytime. I have a US number as well as the one in UAE. So they can reach me, or they can email me. My email address is dr.halowine@gmail.com. It's also on the website. So they can reach me in any shape or form, and I'll be very glad to help them out. Because for me, this is not just a profession, it's my vocation, and it's my mission to heal. Same as Father Muller and Dr. Samuel Hahnemann and Hippocrates of old times. We would like to do our duty, and to help someone is the greatest satisfaction in life. Thank you, Norma, and thank you, Mark, for giving me an opportunity here at MCA-EC to give my talk on migraine and how I can help people world over.
Yep. Thank you, Dr. Halowine. And I think you can go back to sleep, and I'm sure everyone will benefit from this session. And for all our viewers, in case if you want to go to her website, it is www.idealhomeopathy.com. Please do visit her website, and in case you can also call her in her American number or the Dubai number, and I could also send her an email for your specific questions in case if you have any. Thank you, Dr. Halowine, and thank you, everybody. Have a good night, and good morning to you, Dr. Halowine, by the way.
Yeah, thank you, Norma. Bye. And thanks to everyone at MCA-EC.
Thank you.